Surgical technician. There are some diploma programs out there for surgical technician, but now they're starting to move towards that associate's degree, 2-year. Some surgical technicians will go on to school to become a first assist, and then they're what we call some in healthcare is your scope of practice, what you're allowed to do increases. Some people that the first assist is more at that bachelor's level, and then they go on for a physician's assistant. Health information services, some places call it health information materials, and this is more of kind of like that secretarial, but it's not really a secretary either. I think that's a bad term for it, but it's the more behind the business and office work component, especially as we've moved towards that electronic record. Then we have a medical coder, and these people work in the billing office. Some people really like the medical coder position because there is the potential to work from home. So you take the procedure or the diagnosis, and then that's what information is sent to the insurance company, and then or billed out to the customer, and then the accounts receivable. So health information services is about a 1-year diploma degree, and where medical coder is a 2-year associate's degree, or sometimes we do see that as a bachelor's. Physicians, they are unique in depending on which field that they go into. And obviously all of them are at the doctoral level, that they've had their 4 years of their bachelor's degree, then they have their 4 years of grad school, and then they go out to their residency. And depending on where their specialization is, depends on how many years of residency they have. So I'm going to touch base on a little bit on what would be residency and some of those terms that you're going to hear in the schooling. And electroneurodiagnostic technician is one that's a technician that works alongside with the neurologist, and they will be doing studies like sleep studies, seeing how well the nerves are conducting information, or brainwave studies. Then we have a nuclear medicine technician, works alongside kind of a radio an X-ray tech, and the nuclear medicine technician injects nuclear active material, like radioactive material, and so therefore we can see those soft tissue organs in process and what's happening to them. One other thing, this one is an associate's degree or a bachelor's degree as well, but when you're doing that degree search out there, take a peek at it. BLS.gov is a great website. Sometimes it kind of jumps around a little bit, but what's great about the website is you can Google and search all those different healthcare careers. It's going to give you pay ranges. I think that's important to look at. And what's the necessary need out there. Most all healthcare careers are growing. Some are growing more than others. Sometimes the more you get into that specialized area, there's going to be less jobs out there, and sometimes the more diverse area, you have a lot more jobs and choices. You're going to need skills, knowledge, and attitude. And when you look at the curriculum or the different courses in each career path, you're probably going to see that there's lab time, that there's lectures, which are in-class discussions, learning of the knowledge material. Then we have clinical, where you're going to start to go out into our healthcare organizations and start utilizing your skills under the direction of an instructor. Preceptor is a longer program, and typically what happens in a preceptorship is that the students completed most all of their educational training. They're getting close to graduation, so they're going to go out and work with a person in the field for, some programs it says 160 hours. So they typically are going to work the same shifts just as they would in the working type environment, but be assigned to a person who already works out there. With your clinical and preceptorship, you're out there in the work environment, but you're not getting paid for it. Where doctors have residency and where they, expand their skills, and they have different designations of what they do as a first-year resident, second-year resident, to get to the point of working individually and all that critical and creative thinking on your own.